Excelerate Technology, we are driven by innovation. With over 23 years in the tech and communications industry, our mission is to integrate resilient, adaptable technology at the edge of every application. We recently led the consortium for the European Space Agency's Hybrid Connex project. The initial use case was to support digital ambulances of the future. In today's world, ambulance clinicians and many field-based operators require access to connected devices and critical cloud-based applications, where the reliability affects decisions and operational outcomes. East of England Ambulance Service engaged with the consortium to pilot the technology across real-world scenarios. This ranged from rural and remote areas with sparse to zero cellular coverage through to environments such as hospital bays where coverage existed, but a usable internet connection was not available. Ambulance clinicians experienced issues when connecting to their iPads and clinical applications such as electronic patient records, the National Care Records Service, and telemedicine capabilities. Hybrid Connex was a success, improving reliability to the digital landscape, improving clinical decisions, pre-hospital care, and reducing delays in patient referrals and handovers. A range of vehicles were equipped with a varying scale of technology and connectivity services, which integrated with the Hybrid Edge Appliance. By integrating technology and services such as the Hybrid Edge Appliance, LEO satellite, and the Excel cellular optimization antenna, we demonstrated significant benefits to current and future pre-hospital care environments. Overcoming coverage gaps and not spots by leveraging the power of hybrid terrestrial and non-terrestrial networks and improving the connectivity required to underpin the digital landscape. The technology enabled a successful cellular connection in 88% of areas where signal was previously too weak to support a reliable connection. LEO satellite was utilised in 47% of jobs in low or no coverage areas, which was bonded with cellular to provide a consistent and faster internet connection for crews on board. In the remaining not spots, LEO satellite was utilised to fill the gaps and provide 100% coverage. During the pilot, speed tests demonstrated a persistent, high-quality connection, allowing crews and clinicians to make calls, email, share video, and access critical applications without disruption, even while the ambulances were on the move, maintaining performance despite geographical changes that would typically affect the network quality. Apple iPads automatically and securely connected to the ambulance's Wi-Fi bubble with a 99% success rate. Even crews from non-equipped vehicles benefited when in proximity and were able to access clinical applications. In some cases, the connection even extended into patients' homes, enabling staff to make vital Wi-Fi calls in areas with little to no cellular coverage. Results and feedback included seamless connectivity out in the open, the ability to connect Teams meetings from the passenger seat with excellent clarity and a stable connection. One paramedic even said the quality was genuinely phenomenal, with download speeds reaching 150 megabits per second, which was better than some of the main hubs. Trials have now been extended beyond ambulances, and we are now using the same technology and services across 4 hospital emergency departments: Harlow, Peterborough, Luton, and Colchester, locations where ambulance crews and hospital staff have reported incredibly poor internet access. In the first 4 weeks of the trial, 9,000 patient records were updated. During the first 5 months of the trial, seamless connectivity was provided to over 37,700 devices, transferring over a terabyte of data. 99% availability with a download speed of up to 127 megabits per second was achieved thanks to the Hybrid Edge Appliance's bonded connection. The impact of this technology is clear. Real-time connectivity and data transfer between ambulances and hospitals means faster escalations for deteriorating patients, reduced medication errors, and shorter handover delays, helping ambulances get back into service more quickly. Patients too benefit from improved well-being during transfer, especially paediatric cases where digital platforms are used to ease distress while waiting to be admitted. And this is just the beginning.